I'm here today with Dr. Marieka Helou, who is an assistant professor in the Department of Pediatrics here at Virginia Commonwealth University. Will you take a few minutes to tell us about yourself and your role here at VCU?
Sure. I am a pediatric hematologist and oncologist here at the Children's Hospital of Richmond at VCU. I went to medical school at the University of Tennessee in Memphis, and I finished my residency and fellowship here. So I've been at VCU for about 13 years now. About 50% of my time is spent taking care of patients, and the other 50% in teaching and related activities. I'm the co-director for the M3 Pediatrics Clerkship and the fellowship program director for the Pediatric Hematology and Oncology program.
Cool. So we're here today to talk about the Scholarship of Teaching and Learning, or SOTL. Very briefly, can you tell me what that is? Just give us a quick definition.
Sure. So it's sort of the same idea as evidence-based medicine or evidence-based practice. I think a lot of times we think of teaching as getting up and talking in front of a bunch of students, but there's a lot more that goes into it with curricular design, development, and assessment, design, development, and testing. And if you want to do all of those things in a meaningful way, you sort of have to test whether or not you are doing them in a meaningful way.
Yeah. So you actually recently had a SOTL research article published in the Clinical Teacher. What drew you to the Scholarship of Teaching and Learning? Why is SOTL important to you?
When I first took on the roles of clerkship co-director and fellowship director, it was because I love to teach, but also because I wanted to be a part of that curriculum development and reform. I am firmly believe that education is like medicine in that way, that we need to practice not only on experience, but on sound evidence and learn what works and what doesn't in a scholarly way. So to be able to do that, we have to study both the way that we educate and assess our learners.
So your article was titled Student Well-Being and the Learning Environment. Can you describe your work on the project? What was it like?
Sure. In this project, we wanted to look at student well-being and stress, specifically in the third-year clinical clerkships, and what might affect these. It was an interesting project, both because we had a lot of data on a variety of factors, but also because some of our results went against some common perceptions and previous research. For example, we did not find a significant association with well-being or stress and gender or minority status. We also found no association with well-being and a student's performance. We did, albeit, see a weak positive correlation between stress and performance, though, meaning it seems that students who report some amount of stress might perform a little better. Now, we can't comment to causation, but it is nonetheless interesting, and it goes against what we sort of think about being true.
Yeah, that's a good point. It's kind of counterintuitive.
It is a little bit, yeah.
What type of metrics did you collect, if you don't mind my asking?
Sure. So here at the VCU School of Medicine, several measures are collected from medical students at several different time points in their school. We collect, tolerance for ambiguity, medical school learning and environment scale, the resilience scale, the perceived stress scale, the WHO well-being index, and a few others actually.
Okay, so you were able to incorporate these metrics into the research project.
Sure. It was actually a retrospective study of one cohort of medical students surveyed throughout those 4 years, looking at those measures.
Okay. You were first author on the project. What was it like leading the project?
One of the best parts, actually, of leading this project was working with Victoria, one of the other authors. She's a current medical student who had just finished her clinical year. And it was really invaluable to have her perspective on what we were seeing and what we were finding, because, most of the rest of us are pretty far removed from those days. Yeah. So it was really exciting working with her on this.
Yeah, and she probably benefited from getting to see the research process.
Absolutely, yeah.
So on a more general topic, how does SOTL contribute to your skills as an educator?
Well, I think we do a lot of things based on what you might call tradition or experience. It's just sort of always been this way, so that's why we do it this way. But by taking a scholarly approach to how we view education, and medical education specifically, it makes us step back and see things from different perspectives, including the student's perspective, our own perspective, and then even future patients' perspective.
So speaking of perspectives, what perspectives have you heard about this type of scholarship from your learners or residents?
Well, I think that most learners are somewhat surprised when I say I study the way that we teach instead of doing clinical or basic science research. They're not entirely aware that this area of research even exists or that there's a method to our madness, so to speak. Students don't normally think about teaching because they're actively learning. And when they do teach about it, as I said, they often think about just giving a lecture or writing a test, not necessarily developing or testing curricula or assessment tools. So when they realize that there is an area of medical education scholarship and they're passionate about medical education, they get really excited that this might be a possibility for their own career. And I also tell them when they point out problems with the way that they are taught or assessed, that the best way to tackle a problem is to become a part of the solution.
Right. That's great advice. So speaking of problems, can you describe some challenges that you faced and explain how you overcame them?
Sure. I think the biggest challenge in medical education scholarship is no surprise, time and money. There's not a lot of funding for this sort of research, and definitely not as much as there is for scientific or clinical research. And without funding, there's often no protection of your time. So much of this work has to be done on your own time. Right. I've been very fortunate to be connected with some very helpful people in my work who are able to sort of provide a lot of useful skills and useful knowledge that would take me much longer to try to understand or to do. So that has been hugely helpful.
So the networking and connections was
absolutely
helpful in overcoming. So other than networking and connections, what is one key, would you say, to a successful SOTL project?
Well, so I would say that is actually the key, is making connections. Absolutely. Both within your institution and outside of it. I currently work very closely with our School of Medicine librarian and an organizational psychologist from the Office of Evaluation, Assessment, and Scholarship here at the School of Medicine. Mm-hmm. They both have skills and knowledge that are so important to the work that we're doing and that I was never taught or exposed to. And while I can bring a clinical perspective, they bring a scholarly perspective that is incredibly important to the success of this type of research. I've also been very fortunate to complete the Academic Pediatric Association Educational Scholars Program, which taught me some pretty great skills in medical education research methodology, as well as allowed me to make connections all over the country. So it's one thing to study how your institution is doing something in medical education, but it's another entirely to make generalizations to the field of medical education as a whole, and having their perspectives about their institutions and working together with them on projects has been really, really important.
Yeah, I can imagine. So what is your next project? What's next on the horizon for you?
We just published another paper in academic medicine looking at how we make decisions under uncertain conditions in medicine. And so my future research interest certainly involved the medical decision-making process under uncertain conditions and how this affects provider competence, confidence, comfort, and well as ultimately how it might affect patient outcomes.
That's awesome. That's awesome. Certainly an ambitious goal.
Yes,
to
very.
quantify those things. Thank you so much for joining me today and for recording our podcast.